All right, excellent. And now I'm going to share my screen because I do have a couple of things I want to share, and it'll be best done with with slides. So here we go. Tell me when you can see my screen, can you?
Not yet.
Uh-oh. Whoa. Not yet? Okay. We want that.
Sharing now.
Yep. Okay, perfect. All right. Often we think of March as colorectal awareness month, colon cancer month. We don't often take the time to think about there's some other things that are taking place in our lives and awareness we should be aware of. So we wanted to take this time for us to think about something different, and that is that March is Myeloma Action Month. And it's because we want to speak about something that is rare, not something that we often know about. And it's something that I want to introduce to you. And we have a wonderful speaker today, Mr. Gary Crawley, who's going to share his personal story with multiple myeloma. But I want, before we get started, to really talk to you about why we need to bring this to our attention. And the first thing is that multiple myeloma is a disease, a blood disease that affects the plasma cells. So it's a hematologic disorder, and it's something that most people don't think about. So I'm going to talk about it from the face that we always do of how it affects our community. Blacks, Hispanics, and Asian patients have a higher risk of being diagnosed with multiple myeloma than their peers, white peers. What multiple myeloma is this cancerous disease that is formed in the blood bone marrow. And those plasma cells get out of control and they have antibodies on them that are what is able to be detected for that diagnosis. And it's the M protein. That's as much of the science as I'm going to do. What I want you to hear is this. I was reading a SEER publication, and SEER stands for SEER. SEER is surveillance, epidemiology, and end results program. It's a program in which studies are evaluated in cancer to look at the statistics in which they can look at data to help reduce the burden of cancer. So when I showed you that other slide about the effects, it affects Blacks more than others. We have been talking about as a group social determinants of health, access to care, those things. Well, what I want to do today is say, hold up, this particular cancer is not one that they see that may be associated with social determinants of health so much. And that's what this study has found. They show, though, in this 77,000 person review from 2000 to 2019, these results that there was an increase in the risk of early mortality between non-Hispanic Blacks, Hispanics, and the Asians, as I said, as compared to the non-Hispanic whites. Also, older patients had a higher risk of early mortality. When I mean older, it showed that compared to those patients 18 to 58, those who were in these categories 59 to 67, 68 to 76, and 77 to 99 had a higher risk of being diagnosed or risk of death, early death with multiple myeloma. On the other hand, when you look at lower risk for early mortality, you see that women have a lower risk with early mortality with multiple myeloma. Now, here's where we start talking about our income being lower and some other things. What they did was they took a look at income, and patients who had a median income of $70,000 or higher were also at lower risk. Patients who were diagnosed during 2006 to 2011, they had a lower risk. And those between 2000 and 2005 had a lower risk of early death and mortality. And if I didn't say this, and I probably didn't, that when I'm talking about early risk of death, that's like 2 years after diagnosis that someone passes. Okay. So that's what I'm using for that category. And there was those patients who were diagnosed between 2012 to 2017 also had a lower risk of that early mortality, risk of mortality. But here's an interesting fact, and I'm almost finished. Among the patients who had that $70,000 or more, the increased likelihood of that early mortality did persist in the non-Hispanic Blacks and the Hispanic patients, but not the Asian patients. So you remember I was talking about the higher risk? So that's a category looking at income. So when you think about what we think about in some of the social determinants of health, income, wealth, and what you don't have access to, this is one study of 77,000 people that makes us aware that it's not always about social determinants of health, which also makes it even more important that we understand and know about this because it's not something that's going to be talked about. So I'm going to give you a moment to soak that in, and I'm actually going to stop sharing my screen and introduce our guest. Well, before I do you have a question or two that you want to ask about those facts? Just a little education and awareness before we get started. Did I say too much? Was it clear? Thumbs up, thumbs down. Was it clear? Did it hit the mark, Gary, in terms of what we're talking about? Now, this is, for multiple myeloma.
Yes, ma'am, I believe so. And I will just add to what you mentioned, personal observation
Okay.
from going through my first line treatment and meeting an individual who walked right alongside me going through the entire process. And after having some time to get to know him, we just started discussing treatment.
Mm-hmm.
And what was interesting was we were under the same umbrella as far as the doctor or treating physician. And I think, and you can attest to this, that most studies have shown that individuals who were in frontline treatment who utilized a 3-drug tier
Mm.
tended to do much better. They had a better response than those who may have just used one drug. And I say all of that to just say that this particular individual, um, and I'm being a little presumptuous, and this is just based on personal observation and just having some small conversation with him. He maybe couldn't advocate for himself as well as someone else, and I'm not sure where he fell in that median as far as income. Um, but I don't think that he met the mark, just based on general conversation with him. And I say this in discovering he was only on one drug.
Mhm.
And I just looked at that and I could not understand why this individual, and he was a lot further advanced than I was when it came to the diagnosis. Um, and you talked about the myeloma and what it does to the bone marrow. He had the bone lesions and so forth. So it had been manifesting for quite some time. So I would think that they would have utilized more of an aggressive approach to his treatment options versus just one drug. Um, he always
So
complained about insurance. Well, I don't have insurance. And this is what he spoke to me about. And so, you know, I certainly understand what you're saying, and what that study certainly shows that there's a lot of truth to that, to answer your question.
thank you, Gary. And so that just leads into a segue of what we're in store for. I was introduced to Gary, who is a neighbor of Monica Brown. And Gary has been on a wonderful mission to share his story with others in the community so that there is an understanding and an awareness about multiple myeloma. Gary grew up in Blackstone, was it? Virginia, right? And he's been in the service. He was a sergeant there. He was a sheriff. He was a Virginia State police officer. Am I right? I'm going to get this right. For over 20, close to 30 years and is retired. But his passion for service is continued in sharing his story. And we've asked him to join us today to share his story and to give insight into what his journey has been like, much of what you have begun to hear. So, Gary, we thank you, can't thank you enough for coming to share that. So please listen, women, for your sons, your male nephews, all these folks, so that you can help to share that and with friends. And men on the line, if you're there, you have an ear as well for what's taking place. So, Gary, take it away.
Okay, well, Lisa, thank you all for the opportunity, one, to just share my story. And I'll be brief but concise as possible. I will tell you that multiple myeloma, as Lisa alluded to, it's one of these diseases that's sneaky, and you don't really know you have an issue until you have an issue. And I say that because I had absolutely no symptoms at all, none. Here's how my story goes. I'm out running my lawn care business, and I came home for lunch one day. I'm watching television as I enjoy my meal sitting at the table, and a commercial about life insurance came on the television, Select Quote. And I said, you can't ever have too much life insurance. I said, and being the person I was, I knew I was in good health. I took care of myself. I ate well. I exercised. No drugs, no drinking. I did everything a reasonable person could do to live a healthy lifestyle. Well, I pursued the opportunity to acquire more life insurance. And in the process of doing that, as things would have it, they would have a nurse come out to your home and draw your blood, and you go through that whole process, and they take your vitals. Everything was fine. About a week and a half later, the underwriting department contacted me and they said, Mr. Crawley, and I said, yes. And they go, I'm unfortunately, we're not going to be able to insure you.
Mm.
So I have this befuddled look on my face and I said, why? Why not? And the individual on the other end of the phone said, there's something strange going on with your lab work. And I said, strange how? What do you mean? And he says, well, your immunoglobulins are through the roof. And not understanding what that really meant, I said, I don't know what that means. And he just said, here's what, you should do. You need to contact your primary care physician immediately and look into this matter. And I paused for a minute and I said, is this serious? I mean, what's going on? And he goes, well, a lot of different things could trigger an immune response like this. And I said, okay. And then he goes, well, and I said, for example, what? And he says, well, it could be medication, it could be a response to uh, an environmental response. And then he named a few other things. And he said, well, it could be a form of cancer. And I will tell you, that word scares the heck out of me. And I will tell you because I had just lost my brother to cancer in 2017. And a lot of individuals in my family have passed away from cancer. And it's a scary thought to begin with. And the long story short of it, they asked me to follow up with my primary care, and I immediately got off the phone. I called my primary care. They got me in the very next day. And going through that process of poking and prodding again, they drew the blood, more labs, waiting. And that's the worst part is waiting. And you're sitting around and you're not knowing what's going on. So I went through that process. I finally heard back from the primary care. He says, Gary, come on in and let's discuss this. And he says, there's something not right with your labs. Your immunoglobulins are 4,000 and something. And Lisa, that's way out of the spectrum. So the doctor said, here's what we're going to do. We're going to send you over to the Virginia Cancer Institute. And when he said, send you over to the Virginia Cancer Institute, my heart just fluttered. And I tell you, that is a very, very scary time because, when you think of cancer, you automatically think the worst. And it's just the way it is. So I go and I meet with the one of the top doctors over at the Virginia Cancer Institute, and I met this guy, and I didn't like him right from the start. Um, he didn't have any compassion, in my opinion, to how I could have been feeling at the time, and I think his nurse picked up on it. And when he left the room, the nurse came in and she spoke to me, and I never forget her name, Miss Priscilla. She said, Gary, it's going to be okay. You will be fine. And she asked me if I was a Christian, and I said yes. And she said, can I pray with you? And I said, please, absolutely. Let's invite the Lord into this right now. And we did. And it was a very touching prayer. And I immediately felt relieved in a sense because I knew that the Lord was in the midst of it all. So the doctor, as dry as he was, he came in and he said, "Well, this thing is kind of looking like myeloma, and one of these diseases that and that's where I got that term sneaky disease because it came from him." And he goes, "This is one of these sneaky diseases, and we're going to have to be aggressive right away. We're going to really need to get started on this once we confirm everything." And I said, "Well, we haven't confirmed anything yet, right, Doc?" And he goes, "Well, no, but I've seen this enough. I know what these numbers look like. I'm almost certain it's probably multiple myeloma." I had no clue what multiple myeloma was. Well, this was confusing to me because I had just had a complete physical prior to going through the process with Select Quote and acquiring more life insurance. My primary care physician, he missed it. And looking back now, after the fact, I went back and I looked at all of my previous labs. And I went back, and this was June of 21 is when I got diagnosed. So I went back a few years and I started looking at, and you all listening, please take note of this. When you get your lab work from your physicians, pay attention to everything and compare everything from year to year. That's one of the biggest things that I could tell you to do, because in my case, my protein level had been trending up since 2018. So I had a high protein level, but it had just stepped outside of what they considered normal. Now, I shared this with my primary care. I said, "Well, this could have been something that we may have or could have gotten in front of." And he goes, "Well, sometimes we see those protein levels go up and then they drop down, they go up and they drop down." I said, "But the way this thing was incrementally climbing up, it just didn't look right when you go back even further and look at the previous data." And I'm a numbers person. I love data. And when I looked at that, I said, "No, Doc, I think we probably missed this." And then he explained to me that he wasn't even that familiar with multiple myeloma. I had to educate him sometime later after I found out this is what we were really dealing with. Well, um, I will say that starting the treatment process for multiple myeloma, it was probably a week right after I saw the doctor at Virginia Cancer Institute. And that's how quickly we got started. They put me on a 3-drug tier, a medication called Velcade, dexamethasone, and Velcade, dexamethasone, and Revlimid, and which is lenalidomide. All of them are very taxing, to say the least, on the body, on the organs. Just in general, it really brings your immune health down. The Velcade, the way it's administered sub-Q. So you get a shot in your belly underneath the fatty tissue. And the Revlimid you take for 21 days straight, and then you get a 7-day break with that. And the dexamethasone, they had me on a really high dose of that. That's a crazy drug. It was 40 milligrams, but you take 20 milligrams like the first half of the day and another 20 milligrams the last half of the day. You take that once a week. So it's a steroid that kind of hangs around, but that drug has some really crazy side effects to it. It hypes you up. So those are the days when you take that drug, you don't look to get any sleep. You know, you'll stay up all night. If you have something you need to do at nighttime, you'll have more than enough energy to get through that. Um, the the drug itself, the Velcade shot, after a period of time, I didn't have any side effects from that other than the drug really started to cause after this was a regimen of once a week for 8 weeks. And then it went from once a week for 8 weeks to every other week. And then we continued along that line until we got this thing under control. So this was June of 21, as I mentioned, and December of 21. I will share with you Christmas morning. I looked in my portal because I just had a bone marrow biopsy early part of December, and I was waiting on the results from that. So Christmas morning, I read my radiology report and thank the Lord that no myeloma was present after 6 months of treatment.
Wow, amazing.
I was taken back. I was truly amazed, and I gave all the glory to the good Lord because I know that that is something that it didn't have to be that way, and it didn't have to go away that quickly. Um, I will say to you that after receiving that information, it was a little bit of a relief, but at the same time, it really didn't provide me with enough solace, I guess, comfort because I knew based on what the doctors were saying, and this is one of the things that took me back, and I didn't like what his approach to this whole thing. He said, well, myeloma is a tricky disease. And he looked at me and he says, well, when it comes back, then we will figure out the next tier of drugs that we can use to see if we can't suppress it again. And I thought to myself, I said, do you tell everyone that sit in front of you, if they have myeloma, that it's going to come back? And that thing bothered me. And if it had not been for the fact that I didn't want to travel to Charlottesville because there was a myeloma specialist in Charlottesville, and I think at Johns Hopkins, I just didn't want to go up and down the road every week and travel that great of a distance. Well, I will say that the following summer is when things really got crazy for me because August of 22, that was December of 21 when I found out that I was in remission. And then we got to the summer of 22, which was August timeline, is when I had to endure a stem cell transplant. So what happens with the stem cell transplant, they admit you into the hospital, they do all these preliminary tests. But prior to you being admitted into the hospital, you have to go into the hospital over a period of time, usually a few days. They give you supposed to increase your stem cells to the point to where they can be collected. So the harvesting, if any of you are familiar with what the dialysis machine looks like, I would assume, and I'm being a little bit presumptuous there, but that's what my idea of the dialysis machine looking like. So they hook you up to this machine. Your blood is taken from a port. It's a line that gets inserted in your vein in your neck, and it comes out. Two tubes come out of the top part of your chest, and it stays there. This is for them to access and draw your blood, and that process took about a couple of days, and they have to collect 6 million stem cells from you, I believe, and then they take those stem cells and they freeze them until you go into the hospital for your stem cell transplant. So when you're admitted into the hospital, the first day is kind of laid back and you make adjustments. The very next day is when they come in and you're hooked up to an IV pole from the time you get there until the time you leave. And they bring in a large amount of chemotherapy drug, melphalan is what it's called. And the melphalan is designed to kill or eradicate any and everything in your body for the most part, for the lack of a better term, because that's the purpose for collecting your stem cells. Because without your stem cells, it would be difficult for them to rescue you. So when they give you your stem cells back, that is designed to keep you, to bring you back. So the melphalan basically destroys your white blood cells. You know, a lot of times you have to get blood transfusions, platelets. It just wipes out everything. So when they give you your stem cells back that's been harvested, it takes about 8 to 10 days before your neutrophil levels and your platelets and your red blood count, white blood count cells, all those things start to recover. And that's how you're able to survive this ordeal and get through it and start your journey and coming back out and trying to resume some sense of normalcy um, with this new way of living. And I say that because um, the stem cell transplant changes. It really does change you. I think back and I know how I was going into it. You know, I worked out. I was strong as an ox. I had a very sharp memory. But after the transplant, I will tell you the issue that I suffer with the most is memory loss. I have a hard time recalling things since the chemo, um, and it's frustrating at times. It really wreaks havoc on you when you know where you were. From a physical standpoint as well, I lost over 30 pounds going through this process. Some of you might say, well, 30 pounds, I wish I could lose 30 pounds, but I will say not in this manner. So, it was a long, tedious process, but, I am grateful for modern technology and the Lord's will that allowed the medication to do its job. And it has gotten me to the point where I am able to uh, still function and do some of the things that I really enjoyed doing prior to being diagnosed. One of the biggest hurdles that I've had to overcome is just learning how to move around socially. Because when you have a weakened immune system, you have to be selective about where you go, who you're with. You have to really be trusting of the individuals who are around you all the time. And it's a scary thought, but nobody, especially right in the middle of you know COVID and all of that stuff going on, it was a tough time. So how am I doing now? Um, I'm doing good. A lot of crazy things that took place since then. There's a lot of anxiety that you have to deal with. One of the things that helped me overcome the anxiety is that what I did for myself. I like to, as I mentioned before, I'm a numbers guy. I love doing research. And the more I knew about the disease, the better I felt, because knowing that the technology is always evolving, knowing that they are always engaged in all these different studies um, that were going on, it helped satisfy me to the point where I know, thinking back and knowing what I found in my research, was that many, many, many years ago, I'm going to say I'm going to put it at 15 years ago or so now, when you got multiple myeloma, your diagnosis, it wasn't good. 3 to 5 years is all they gave you. Um, and Lisa probably can share more information on that. But so you dealt with guilt, because you have to put your loved ones through the same process that you're having to endure. People who are really close to you, um, you know, people you really care a lot about, they're going through this thing right alongside you. And, you know, I have a very, very, very close friend, and she says, I'm here for you. I'll always be here for you. And it's good to know that you have, you know, a strong supporting cast of people who care enough about you and love you, that can walk that road with you, because it's hard, and it's tough sometimes when you're having to deal with these things and you feel like you're by yourself, because um, you spend a lot of time alone because you don't want to be around a lot of different people. So that comes in, and then you have to deal with depression. Um, I'll tell you this: sadness and depression are different. Um, a lot of us get sad from time to time for various reasons. But depression is one of these things that is persistent, and it doesn't go away very easily. You have this persistent feeling of hopelessness, feeling worthless at times because you remember where you were, um, and you remember how you used to move and go and perform. There's a lot that happens to you after you go through this stem cell process. Um, Cancer changes who you are as an individual. I don't care what anybody says. There's no easy way to manage the distress that goes along with it. Every day you wake up, you think about the disease. You try to find an outlet. My way of dealing with it was, I love to be outside. I love to, cut grass. That's my therapy. I exercise. I communicate with those who truly understand what I'm going through, who may have similar experiences. Um, Negative and the negative of positive thinking. I'll wrap it up real quick. That's a thing, and it's kind of hard to get your head around it. But if you think about it a minute, the negative of positive thinking, it always seems like there's pressure to maintain a positive attitude when you're scared and you're having to deal with a disease like this, and people will be quick to tell you, hey, you need to stay positive. You got to stay positive. Um, Let me just say this to you. There is absolutely no need to please others. You have to do what you have to do, and whatever way makes you feel good, and you dealing and controlling what you're going through, whether you try to maintain a positive attitude, but I'll just say it's okay not to be okay sometimes. Um, and with that, I will leave you. I think I've been talking for about 30 minutes or so. I thank God for this opportunity to share my story with you all. And I hope you all have questions. It's, I'm here. I'm an open book. I'll be more than happy to answer any questions that any of you may have. Lisa, I don't see you on the screen. I see Gwen on the screen right now. If
Well, I'm here.
Okay,
Okay. And thank you for sharing your personal story and what you experienced and how it affected your life. What I heard you say was who you were before the diagnosis, who you are now because of the diagnosis and the treatment, and how you've made the adjustment. I wanted to ask you about how you were told about your diagnosis, and you already did that. You shared what your physician said. So there may be other questions that others on the line have. I have one important question for you, but I'm going to give others that opportunity before I ask something if they have questions.
Hi, Lisa. This is Mary.
Mhm.
Hi, Gary. Just
hello.
so you know, I'm almost a grown up neighbor. I'm from Kinbridge. So,
Okay,
but I have two questions for you. One, this may be a Lisa question. I don't know. When we first started talking, and when Lisa started explaining this, it sounded almost like leukemia. But as you went on into it, I could see there was a difference. And the second question, so I can get off, I know other people have. Did your insurance, were they nice to you? Did they take care of most of this? Because it seemed like you went through a lot of treatments. Those are my questions.
okay. Well, myeloma and the leukemia are both blood cancers. But myeloma, and I don't know a lot about the leukemia, but I will tell you that myeloma is, from what I understand, is probably in a whole different realm. With leukemia, I think and Lisa can answer this, it may be a disease that is curable, but myeloma, they do not have a cure for yet. So I have to remain uh,
Treatment.
in treatment, in a maintenance treatment for the rest of my life until they either find a cure, or I just say, enough is enough and I don't want to do it anymore, because maybe the side effects over time, it just becomes too much. And I'm sorry, what was the other question you had?
Insurance.
Insurance. So, I'm fortunate because having worked in state government for 30 plus years, I have a really good healthcare policy, and they have not had a real issue with taking care of some of the associated costs of the treatment. I will say this, that my medication that I take, my insurance does not cover all of it. The medication is $22,000 a month. That's just for the oral med. So each pill that I take every single day is, about $800, $900 a day. And I was told, and I'm fortunate that they shared this with me, because I'm almost certain that they wouldn't share this with everyone, but I don't want to put that out there too much, because I don't know. I can't say for certain, but I will say that without the um, programs that are out there to help supplement your insurance, I couldn't. There's no way I could afford to get the treatment that I need in order to maintain this quality of life that I'm living right now. Um,
So I'll support you on that. Many of the pharmaceutical companies that make these very expensive um, medications have access programs that help you get the drugs that you want. That's what you're talking about, and they do provide you with that information. And Mark put in the chat, you are absolutely right in what you're discussing when you think of leukemia and you think of multiple myeloma, Mary. They're hematologic disorders. So they're blood related disorders, but they're different types of blood cells. And when we started the conversation, and Mark put it in the chat, the plasma cells are the cells specifically in the blood that are affected for multiple myeloma. And what Gary was discussing about his diagnosis was my question, because he started by saying he was asymptomatic. And one of the important things that that is done in staging this particular cancer is done in a way with asymptomatic, if you don't have symptoms, and if you do have symptoms. And it directs you in the way that you're going to be staged. And there are 3 stages. So there are a lot of things that I'm sure, Gary, you could have discussed with the diagnosis, et cetera, et cetera. But I just wanted this group to understand that there's more information as to what Gary was saying about getting induction, having maintenance, having stem cell treatment. And I think it's very profound that you said that. Do you tell your patients that all the time? And what you said is it's not curable. And so you're going to be on maintenance therapy. And the lack of sensitivity, I think, for each to share with each patient that sometimes can happen with physicians or even us. You can think about it when something becomes so rote that it's like, okay, it is going to come back, but you didn't have to say it like that, did you? You know, it is something that is recurrent and it does happen, but he could have expressed it, and that lack of sensitivity is something that you want to find in a culturally sensitive way of communicating. And there are programs out there that are looking to be more culturally sensitive to the way that things are being introduced to us. So I'll stop right there. But Mary, I hope that helps in terms of, plasma cells. I mean, albumin, when he's diagnosed, it's like your albumin that you need to look at. You want to look at uh, all your plasma cells, the IgGs, your IgA. When you think of your mast cells, when you think of everything for infections and allergies, those are the things that come to my mind when you think about it. But that's why he said, look at your blood reports and go from there, and you can find out. But it's it's significant, even your lactate dehydrogenase is another one that you would look at and need to follow. But we've talked about, and I'm glad you said it, know your labs and know them the year before, know them the year prior, and be accountable for what those labs are. And I think many of you are. Just share that with your friends and colleagues. Just say that's what it is. And I know I'm proud of the way that you've embraced, you know, it's okay not to be okay. It because it is okay. And I was, that's part of mental wellness is to admit and to know. And Nicole, you can speak to this. I mean, while you're living with multiple myeloma, I know Nicole is not, it's not uncomfortable for me to say that Nicole lives with pulmonary arterial hypertension every day. And so some days are good and some days are bad. Others of us on the line are living with other things ourselves. How we come and face that each day. But thank you for being honest enough to say what you did about how you face it and what you do about it. So, hey Mark. Hey Mark.
Hey, everybody. I just want to thank Brother Gary. Right, I couldn't hear
Yes,
clearly if he was saying Jerry or Gary, but
Gary.
Gary, I want to thank you for your courage and your exquisite articulation and chronological explanation of your experience. That's very valuable and very helpful to all of us here. I just want to comment a little bit on just a couple things he said, because everybody know I can talk too much, but I just have a couple things I'll comment on based on what he said, that I ask really everybody to really pay, in addition to everything he said, particular attention to a few things. Number one, notice his fitness and his quality of life, and how abrupt and unaware this particular disease snuck up on him. This is one of those diseases that is less influenced by the way you live your life. And everyone is probably falling out of your seat, because I'm always talking about the way you live your life, the things you eat, your quality of life, all those all those social determinants of health that Lisa alluded to very much matter. The jury is still out with regard to the level of impact this particular disease, multiple myeloma, is on those differentiators, those independent variables. So recognize that here we're talking about a very fit, very cognizant, clearly a very intelligent, very aware person, and they had to recognize this and do something about it. That's important, because what does that say to us? Those of us who just would rather have a Twinkie and don't even care about seeing a doctor and don't take that. That means that we have to say, wait a minute, maybe my lifestyle is detrimental to my health and my likelihood of having a negative outcome. And I need to maybe consider adopting some new ways of life. If a person is fit and on top of it as he is, have to act, look, maybe what I have to do. So I'll stop about that. But I think that's and I don't want us to miss that, to recognize that, believe it or not, there are things that only way we can, medicine and technology, as he articulated, can even get in the game, is that you own responsibility of your health and not give it all to the doctors, and recognize that they are your partners. They're not your Jesus, okay? They're your partners. The other thing I want to clear up too, I think we talked about one of the social determinants of health indexes. I have to be very clear, that's an index being income. So let's be very clear that if any of us scratch off and all of a sudden become billionaires overnight, that does not automatically impact your physicality or your risk of developing a disease or an outcome. What it means is research shows that people who have higher income levels tend to have access to more resources. They tend to have access to more treatment options. You notice he spoke a little bit about how one patient was afforded or offered a very certain treatment regimen. It included, in that other unfortunate patient's case, a monotherapy or one drug, where he knew that in his case, a triple therapy or a therapy that included, I'm sure you said Velcade, dexamethasone, and another drug, be that the model chosen by your doctor and you. But anyway, the fact that you get more money doesn't automatically change your risk. It's just an association. So I wanted to make certain that wasn't lost. And then the last thing, and I'll shut up, is as another takeaway, I'd ask us, Lisa is providing these amazing programs with this fantastic testimony and insight. And we need to interpret it as an opportunity to build community and say, no longer will I be shy or shy away from talking about my health condition. But guess what? It's a human condition. It's not yours. You don't own it. If you develop a disease, it is a disease of humanity. So that day where we say, I'm too ashamed, or I'm too proud, or I'm too embarrassed to discuss my health condition, we need to throw that out the window and allow ourselves to partner with one another and have a community of health where we're promoting and encouraging one another. I'm done talking. Brother, it was a pleasure to virtually see you here. Of course, everyone know I love you here. Thank you for your engagement, and I'll shut up. Thank you. Thank you.
Lisa, I have a question.
Yes.
This is Marguerite. I just want to know if it's hereditary, and if so, is there some any way of getting around the disease if it is hereditary?
It's not hereditary. It is not.
Oh, okay.
Mm-mm. It's it's one of those that it can just occur. It can just happen. It's yeah. The proponent, I don't think it's hereditary. So stop. Shh. Sorry, my
I
phone
just
was
heard Gary say that.
yeah.
I just heard Gary say that a lot of his family members had died of cancer.
Yeah, they various different types. My brother passed away. He had he never was a smoker, but he somehow developed lung cancer. Um, my grandmother, my grandfather, their siblings, my uncles, and even my mom, who's still living today. She had triple negative breast cancer. Um, uh, that's a whole nother story. Awesome testimony that goes along with it as well. We'd love to share that with you at some point, someday. But she has been in remission for quite some time now. I want to say well over 8 years.
Praise God.
And this is my mom is the same one of the same individuals, and I don't know if you all remember this. For those in the area, I'm not sure where everyone's located. There was a really bad, and we're coming up on another anniversary, by the way, with this. It was a bus trip going to a revival service down in Dinwiddie County, where the church van was struck in the rear, and there were 4 deaths associated with this horrible crash. And my mom sat right in the middle of all 4 of those individuals that passed away. The Lord spared her
Wow.
once again. But yeah, we all have some stories. I do know that, and it's great to fellowship and speak with one another from time to time. You learn a lot from individuals just by listening, and I love to listen.
Okay, thank you.
So I looked this up for you, Marguerite, just to be clear. The somatic cell, the cells, the plasma cells, they have a mutation. So that's what's happening with them. And because Gary's family members have cancer didn't mean that he would have multiple myeloma. But because Gary has multiple myeloma, there could be a risk factor for somebody directly having multiple myeloma after him. But because these others were not multiple myeloma, it would not make it so that that's why he has multiple myeloma. But that's just
Okay.
but it's not a truly inherited disease. That's just a risk that could occur. Okay.
Okay. Okay.
Okay.
Thank you.
Mm-hmm. Anybody else? Any other questions?
I'd like to know, Gary, I appreciate your story. Thanks for sharing. I'm just wondering if you're still with that same doctor, or your relationship with him, has it gotten a little better over this time?
Over time, when it has gotten better, he's still very dry, in my opinion. A little bit of a personality issue, I think, from time to time, but um, I'm okay with the treatment regimen. For the time that I have to deal with him, I'll deal with him. Um, and not everyone has, the type of personality that is conducive for wrapping your arms around. And doctors are sometimes strange individuals, and you just sometimes their bedside manner needs some adjusting. So I never said anything other than what I mentioned to you all, but I did hurt him in a survey that the hospital sent out to me. So I did utilize that method.
Did you feel comfortable in his care? So that's the main thing.
Yes.
Yes.
Mm-hmm. That's honest. I liked what Mark you did say about winning the lottery or something, that income doesn't change. But I think access to care is critical. We have to pay attention to that, and we have to take care of ourselves. And that's what you just said. Watch our body, watch what we eat, be kind to each other, love each other, and do what we can. And that's why we come together each month, so that we have at least a way to be a sense of community and to share. I'm excited to share that next month, Lupus Awareness Month, we're going to have someone who is going to come to us to speak about their lupus journey. So we're very happy to share that. And this presenter, it's Ashley Canty.
Oh, Ashley.
Yeah, yeah. So she accepted the offer for us to have her come, and she was diagnosed very early with lupus. And I hope you'll spread the word, because women are more affected by lupus than others. So this is our opportunity to get the word out about lupus. So thank you for joining us. If you have additional questions about anything else, don't forget that you have our everyday health, that we should be using our online resources. Multiple myeloma resources will go out to you after that, as well as we will have the recording posted so people can have it and share it, watch it, look at it, and tell your friends. And don't forget, you have an opportunity to share with us the topics that you'd like to have. So thank you. I'll hang on the line if you want anything, and I'm going to stop the recording now.